Thanks for joining me for day 2 of this 8-day return to exercise post-concussion. Today we're going to be talking about the importance of returning to exercise, not just for the post-concussion brain, but for general health and wellness. So I'm still Jessica Klain, a physical therapist in Colorado, specializing in concussion and vestibular disorders. So reviewing what we covered in session 1, we talked about the physiology of exercise intolerance. So we know that it is really common in the post-concussion brain to experience exercise intolerance. And not that long ago, the recommendation was to rest completely for your brain and for your body after a concussion. But now we know that light exercise should be resumed as early as 3 days post-concussion so that we can promote that healing process as quick as possible. So exercising. So there's a lot of different reasons to exercise, and there's a wide range of the benefits of exercise for everyone, not just post-concussion brains. But we see a lot of physical benefits of exercise in the reduction of major adverse health issues. So this is heart disease, diabetes, obesity, even certain cancers. And overall, we see a reduction in overall mortality of 30%. That is a reduction in death. So lots of good things for our bodies because of exercise. We also see specific benefits on our musculoskeletal system. So that's our joints, our ligaments, and our cartilage. So exercise shows improved bone strength, improved muscle, ligament, and tendon health, reduced fall risk, and reduction in symptoms associated with arthritis, which can be a major limiting factor in activity later in life. But it's not just the body that we see benefits. We also see mental benefits. We see improvement in sleep quality, reduction in anxiety and depression, and just overall improvement in quality of life. So this is what the research is saying. And research and the information that comes out of it is great. But even without these research benefits, it's good for our soul, it's good for our community in terms of social interaction. So there's more to exercise than just what we see on this slide. Specific to the post-concussion brain, one of the main benefits of exercise is to improve brain healing. So when you exercise, there's an increase of blood flow, which means there's an increase in oxygen to the brain, which allows for cell growth and neuroplasticity, which means that the brain is reforming those injured connections due to the axonal injury from the impact of the concussion to allow those cells to function the way that they did prior to the concussion. We also see an overall reduction in symptoms. So this can be related to the healing process, but it can also just be related to the overall benefits of exercise. So we see a reduction in headache frequency, improvement in sleep quality, reduction in fatigue, improvement in cognition, and improvement in mental health and reduction in depressive symptoms. So all of these key symptoms that are associated with post-concussion syndrome, we see a reduction in those symptoms with regular exercise. We also see an improvement in the nervous system regulation. So we talked a little bit in the first session about how the autonomic nervous system is affected in post-concussion syndrome and how that relates to exercise intolerance. So one of the things that exercise can help with is reestablishing that autoregulation, the autonomic nervous system communication with the cardiovascular system to help normalize those dysfunctions at the heart rate level, the blood pressure, and the vascular blood flow in your brain. So all of these things are important on a foundational survival way. Obviously, we need our heart to beat, we need a certain amount of blood pressure to survive, but the regulation of it will help you function better, not just in exercise, but in regular life as well. Neurovascular coupling is an interesting thing that we can see on certain functional MRIs. We know normally that when a certain activity is being performed, so tennis versus running, so a hand-eye coordination sport versus a lower extremity sport, creates a different pattern of blood flow in the brain. And this is associated with the need for certain areas of your brain to get the oxygen and the glucose it needs to perform that specific activity. So what we see in the post-concussion brain is that there is a neurovascular uncoupling, meaning that the pattern of the activity and the pattern of blood flow in the imaging do not match up the way that they should. And we assume that's because of the damage that the concussion has created. So that can be the damage related to the nerve cells. It can be the disruption of the autonomic nervous system. It can be all of the above. So we know in the post-concussion brain that the areas of the brain that need the glucose and oxygen to perform that task that you're trying to do is uncoupled, meaning that it is not getting the oxygen and the glucose that it needs to perform the task that you want to. So exercise can promote that neurovascular coupling. So in an ideal scenario, you get a functional MRI to determine these specific locations that you are experiencing that neurovascular uncoupling, and then we do body exercises and cognitive brain exercise to specifically target that dysfunctional area of the brain to promote that normal neurovascular coupling, to ensure that the areas of brain that are related to that specific task are getting the oxygen and the glucose that you need. So this gets a little bit more complicated in terms of developing personalized exercise programs, and we as a healthcare community, at least in the United States, don't always have access to these higher level imaging studies, but they are out there, and I'm hopeful that in the next 5 to 10 years that this is going to become more of the norm in terms of how we help people in these post-concussion phases where we're seeing some of these detrimental effects of these long-term concussion symptoms. So today we talked about the importance of returning to exercise. In our next session, we're going to talk about how to overcome some of the overall limitations that can interfere with getting started or developing that motivation and the interference that sometimes we can get that can be legitimate, or sometimes it's just a little bit of fear, a little bit of unknown that we need to overcome a little bit in terms of getting back to exercise. So any questions, feel free to contact me in any form that you feel comfortable. I am always here to answer any questions that you might have. And then again, for anybody that wants to do a little deeper reading, here are some references. So thanks for joining me for day 2. And on day 3, we'll cover just general tips for getting back into exercise.